Hello wrestlers, my name is Ben, and today I'm going to help you learn how to identify some of the most common skin infections that you can see in the wrestling ring. So the first one we're going to talk about today is impetigo. That's a bacterial infection, and it's a type of staph infection, and you can see a picture of it right here. So when you first have impetigo, you might not even notice it. You'll get little red bumps, and they'll almost look like a pimple, acne, or ingrown hair. But after a couple days, these bumps will burst, or they'll begin to ooze out the fluid that's inside of them. And from there, that fluid will form a honey-colored crust. That honey-colored crust is the telltale sign of impetigo. From there, these sores will likely be itchy. But what you don't want to do is itch the sores and spread them to other places on your body. So to prevent that, you can put on a bandage or just a Band-Aid or a piece of tape to stop you from itching it and continuing it to spread it to yourself or your teammates. Again, if you have impetigo, you will not be able to practice. So going from there, to get you back in practice as soon as you can, you're going to want to see a doctor or wherever you go for medical treatment and get some medication to help get past it as quickly as possible. Likely it'll be some type of antibacterial ointment, or in severe cases, they might give you other supplemental medication. The next skin infection we're going to be talking about today is ringworm. Ringworm isn't actually caused by worms. Ringworm is a fungal infection caused by dermatophytes. So what does ringworm look like? Here's a picture of it right here. The first thing you're going to notice is a reddish, pinkish ring of raised skin. That rash will also have a scaly appearance to it, and you might even notice hair loss in the area. The main symptom you're going to see other than its physical appearance is that it's going to be extremely itchy. Keeping this in mind, it's important not to itch it because that's how you continue to spread it to the rest of your body. So to stop you from itching it, you're going to want to go ahead and cover it up and then head to the doctors to get some treatment for it, likely an antifungal cream. After you are no longer contagious, you may still see the rings present, but they will begin to fade quickly after this. The final skin infection we're going to be talking about today is herpes. Herpes is a viral infection caused by the herpes simplex virus. Here's what it might look like during a flare-up. What this looks like is small blisters or these small fluid-filled bumps, and if these bumps are popped, they can develop a crust. There's often a burning or itching sensation that goes along with this, and an individual can experience flu-like symptoms, including a fever or muscle soreness during a flare-up. So herpes is a little different than the last two we talked about because it is a viral infection. This means that while you can treat the symptoms, once an individual has contracted herpes, they will have it for life. But individuals are generally only contagious when a flare-up happens, and this can be transmitted through skin-to-skin contact with the affected area. So if you do notice this, it's important to go to your doctor and talk with them about potential treatment options. From there, once you get your symptoms under control, you are generally safe to return to practice as you will no longer be contagious.
So why are wrestlers such a target audience for these group of infections? Well, wrestling is an extremely high-contact sport that places athletes in constant close physical interaction, making them uniquely vulnerable to contagious skin infections, such as ringworm, herpes gladiatorum, and impetigo. While many of these infections are more commonly associated with children or the general population in isolated cases, wrestlers represent a niche target group where these conditions occur at much higher rates. This is largely due to the nature of the sport, which involves prolonged skin contact, frequent injuries, and shared environments that can harbor infectious organisms. Unlike most adults, wrestlers are repeatedly exposed to the conditions that allow fungi, viruses, and bacteria to spread rapidly. As a result, skin infections that might otherwise be uncommon for adults become a significant issue within the wrestling community. Firstly, let's begin with ringworm. Ringworm is most common amongst children and athletes as this group experiences a lot of close interactions in shared spaces like school and locker rooms. It is extremely prevalent in high-contact sports such as wrestling. Wrestlers commonly develop ringworm, also known as tinea gladiatorum, because of the close prolonged skin contact involved in the sport. This direct contact makes it extremely easy for fungal infections to pass from one athlete to another. In addition, the warm and damp conditions created by sweat, along with shared items like mats, protective gear, and unclean equipment, create an environment where this fungus can thrive. According to the National Federation of State High School Associations, NFHS, up to 70% of student athletes who participate in wrestling get this infection each season. The high contagion level and the fungi's preference for moist and warm environments make this fungal infection a common nuisance for wrestlers. Next is herpes gladiatorum, also known as mat herpes. Mat herpes becomes a severe problem for wrestlers due to this infection lasting a lifetime. It is transmitted through skin to skin contact or through sharing contaminated equipment, such as mats, hence the name. People can get infected by others who have this virus through touching their sores or blisters and infected gear, towels, soap, mats, equipment, etc. While there are periods of time the virus can become dormant, this virus may reactivate and transmit to others without any noticeable symptoms. Prolonged skin to skin contact in wrestling significantly increases the risk of contracting this virus as it involves sustained physical contact, frequent abrasions, and can easily spread through direct exposure of infected skin lesions or even asymptomatic bodily shedding. Research from organizations like the National Collegiate Athletic Association (NCAA) and the Center of Disease Control and Prevention (CDC) has shown that outbreaks are more likely during periods of intense training or competition when wrestling athletes have repeated and prolonged contact with skin. Finally, we have impetigo. Impetigo is a bacterial skin infection most common in children. This infection is highly contagious and is spread through physical contact or contact with infected items, for example, towels, bedding, clothing, toys. According to the Cleveland Clinic, it often enters the body through skin abrasions, such as cuts or scratches. It is not common amongst adults, but this bacterial infection is prevalent in wrestlers. The infection hops from contaminated mats or shared equipment into sores, rashes, abrasions caused by the intensity of the sport. Impetigo is most commonly found on the face, neck, or upper body, which is a commonly exposed spot for intense grappling, tugging, and bodily contact, in which an infected individual's sores might open, or other bodily fluids such as sweat, spit, might be exchanged with the other person through repeated friction and pressure. Wrestling also gives bacteria a perfect moist and warm environment to grow, making impetigo a common problem in this sport.
In wrestling, you expect to take home a medal or possibly a bruise, but definitely not a rash that makes your team avoid you like the plague. Because here's the truth. Every time you step foot onto the mat, you're not just wrestling the person in front of you, you're facing a bigger battle, something beyond what you can see. Bacteria, fungi, and viruses that aren't visible to the naked eye, hitchhiking on sweat, skin, and contact from every other athlete in the room. Even though we all know you guys don't get hurt and you just adjust your pain tolerance mid-match, your one vulnerability that can sneak up on you and put you in a chokehold is skin infections. So today's PSA is about 3 of the stealthiest opponents that share your love of wrestling rooms: ringworm, herpes gladiatorium, and impetigo. First up, ringworm. As Ben had mentioned, despite sounding like something you'd find in a horror movie, it is not a worm. It is a fungus that decided your skin was a great place to open a circular red business. In wrestlers, it usually shows up on the head, the neck, and the arms. Basically, the exact places everyone grabs you. Treatment for ringworm includes topical antifungal medication and oral antifungal medication for more extreme cases. You apply them twice a day for 2 to 4 weeks. Yes, 2 to 4 weeks. No, it looks better is not medical clearance. That's how you let ringworm win the rematch. Return to wrestling usually requires at least 72 hours of treatment plus clearance from a healthcare provider. Because coach said I'm good isn't a medical degree. And in the sport of wrestling, that kind of logic would get you disqualified faster than an illegal move in the third period. Next, herpes gladiatorium. This is the one that sounds like a Roman emperor's curse, and honestly, not far off. It shows up as clusters of painful blisters or sores, usually on the face, the neck, or the arms. First outbreak, worst one. After that, the virus sticks around like a match that never officially ends. Most of the time, it's just quietly on the sidelines, but when you're stressed, sick, or pushing hard, it jumps back in an unexpected overtime, and suddenly you're dealing with it all over again. There is no cure, but antiviral medication can reduce severity and shorten outbreaks. Some athletes may use daily suppressive therapy to lower flare ups and transmission risk. But here's the non negotiable rule: active herpes gladiatorium does not wrestle. No exceptions. No, just drilling. No, I'll stay on bottom only. If it's active, you're out. Return requires everything to be fully crusted over, no new lesions for at least 72 hours, at least 120 hours of antiviral therapy per NCAA and NFHS guidelines, and medical clearance. If this sounds strict, it's because your teammates don't want your skin condition running up half their lineup. Finally, impetigo. This one is basically the overachiever of contagious skin infections. It spreads fast, grows fast, and loves wrestling rooms like they're an all-inclusive resort. It often starts as red sores or blisters that rupture and turn into a honey-colored crust, which is a very generous way of saying it looks pretty gross. Treatment depends on how far it's gone. Topical antibiotic cream for small areas, oral antibiotics for a bigger spread. Return to contact only happens when lesions are fully healed and crusted, usually after at least 48 hours of antibiotics. And yes, you should actually clean the area gently. This is not the time for aggressive scrubbing like you're trying to win a bonus point. The bottom line is, wrestling is already hard enough. You don't need your skin forming its own rival team. Check your body, treat early, finish your meds, and don't be the reason your entire squad gets the no contact lecture, because on the mat, the only thing worse than losing is losing to something you could have washed your hands about. Now on to Hanwoo for learning about preventative measures.
Thanks, Frankie. My name's Henru, and I'm here to bring you prevention. If I asked you guys what's harder to be, the top-ranked wrestler in your weight class or something you can't even see, what would you say? Statistically, the real opponent in wrestling isn't always across the map. It's skin infections, which account for over 17% of all time loss conditions in wrestlers. Now, this may not seem like a lot, so let's compare it to a different contact sport like football, which reports 2.32 infections every 100,000 times athletes participated versus a whopping 28.56 for wrestlers. Now, this should be alarming news. Imagine training months for a competition and being disqualified due to a skin infection. So today, we're going to talk about what is actually trying to keep you off practice and how to stop it. First up, it's tinea corporis, or better known as ringworm. Stay with me, it's not an actual worm, but a fungal infection. Contrary to popular belief, this is not contracted from the mats. Don't take this as a free pass to not clean them, you still need to be wiping and cleaning those mats routinely. To prevent ringworm, you just need to keep good hygiene, which by the smell of the locker rooms seems to be a challenge for a lot of you. So let me take it step by step. Make sure to take a shower after a practice or a match. This does not simply mean rinsing off with water. You better be scrubbing where the sun don't shine. Make sure to wash your hands throughout the day with soap, singing happy birthday 2 times in the mirror. Change your workout clothes and socks daily. This means washing them and not picking the best smelling one off the floor. And seriously, perform skin checks daily and make sure you have a trusted adult to check hard to see areas to keep yourself protected. Report any lesions, redness, or itchiness immediately. There is also extensive evidence showing that the use of a barrier cream, especially from Kenfield Industries, reduced cases of ringworm from 10 to 1, protecting wrestlers for up to 4 hours. Now it's time to talk about herpes gladiatorium, better known as mat herpes. Don't be alarmed, this is not the type of herpes you might be thinking of, but similarly, we always have to use protection. Contrary to ringworm, this is a viral infection that never goes away, so it's incredibly important to practice prevention methods. Like mentioned before, herpes gladiatorium is mostly spread through skin-to-skin contact, which is inevitable for wrestlers. Similar to ringworm, it's important to practice good hygiene. However, there are some more preventions to take for this specific infection. Try to clean your towels and uniforms with hot water and detergent, bleach if possible, and dry on a high setting, which is more effective at killing the virus. Something else that is important to mention is cleaning your knee pads, helmets, and shoes. Now, these often get neglected in terms of cleaning because it's not as straightforward as simply putting it into the laundry. However, these often contain sponges similar to mats that soak up sweat and heat, acting as the perfect home for these pesky viruses. There are also medications that you can take to prevent and reduce the chance of contacting herpes gladiatorium. A study at the University of Minnesota's wrestling camp showed that taking 1 gram of valacyclovir, an antiviral, a day lowered the incidence of individual outbreaks by 89.5%. Now, I don't know about you, but that sounds pretty good to me. Now, let's talk about staph infections, which are kind of like elite wrestlers. They're opportunistic, aggressive, and if you give them an opening, they're taking you down. Now, staph infections can consist of things like MRSA and impetigo, so it's important to prevent the bacteria from entering any cuts, blisters, or wounds, no matter the size. There are many ways to prevent contraction and the spread of this infection. First, if you have a cut, blister, or wound, it's important to completely wrap it up on all 4 sides before any type of match or practice to reduce the chance of infection. Additionally, there are things like antiseptic body washes, which contain CHG, a powerful agent used to reduce the number of bacteria on the skin. There are also other creams you can apply to prevent infection as well. Now, I know what you may be thinking, another cream, but at least we know you won't be ashy. Now, you guys may already know this cream called muprissin, which is often applied on the inside of the nose. Now, you may be asking why the nose, but as I explained earlier, the bacteria often lives on the inside of humans' noses. So when applied there, the number of bacteria is reduced that can spread to cuts and wounds. Additionally, there is new research that shows more promise in the muprissin cream, another preventative cream with the active ingredient iodine that has a winning score of 2 out of 3 against the bacteria. At the end of the day, preventing infection isn't that complicated. You just have to be consistent. Make it a part of your routine, like working out and practicing. It should be something that you don't think twice about doing. Because the easiest way to lose mat time is to get taken out by something that could have been prevented. So control what you can, stay clean, and keep yourself in that lineup. That's it from us today. Thank you for listening, stay healthy, and stay on the mat.